Chlorthalidone is used to treat high blood pressure, hypertension. Lowering high blood pressure helps prevent strokes, heart attacks, and kidney problems. It is also used to reduce extra salt and water in the body caused by conditions such as heart failure, liver disease, and kidney disease. Decreasing extra salt and water in the body helps to decrease swelling, edema, and breathing problems caused by fluid in the lungs. Chlorthalidone is a water pill, diuretic. It increases the amount of urine you make, especially when you first start the medication. It also helps to relax the blood vessels so that blood can flow more easily. How to use? Chlorthalidone comes as a tablet to take by mouth. It usually is taken once a day or every other day after a meal, preferably breakfast. It is best to take this medicine in the morning to avoid going to the bathroom during the night. Initiate therapy with the lowest possible dose, then titrate according to individual patient response. Hypertension. The initial recommended dose is 50 mg once daily with food. After 2 weeks, the dosage may be increased to a single daily dose of 25 mg if additional blood pressure reduction is needed. Doses above 25 mg are not expected to result in increased blood pressure reduction. Edema. The recommended initial dosage is 50 to 100 mg daily or 100 mg on alternate days. Depending on response, dosage can be decreased or increased up to a maximum of 200 mg daily. Contraindications. Hypersensitivity to chlorthalidone or sulfonamides, failure of the kidneys to produce urine, anuria. Precautions. Chlorthalidone may cause symptomatic hypertension. Patients with sympathetic response, volume depletion, or who are salt restricted may be at increased risk for developing hypertension. If hypertension occurs, place the patient in the supine position and, if necessary, give intravenous normal saline. A transient hypertensive response is not a contraindication to future treatment, which usually can be continued without difficulty once the blood pressure has stabilized. Changes in renal function, including acute renal failure, can be caused by diuretics. Patients with chronic kidney disease, heart failure, or volume depletion may be at particular risk of developing acute renal failure on chlorthalidone. Side effects. Dizziness, lightheadedness, or stomach upset may occur. If any of these side effects persist or worsen, tell your doctor or pharmacist promptly. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a lying or lying position. This medication may cause dehydration and electrolyte imbalance. Tell your doctor right away if you have any symptoms of dehydration or electrolyte imbalance, including extreme thirst, very dry mouth, muscle cramps, weakness, fast irregular heartbeat, confusion. Tell your doctor right away if you have any serious side effects, including fatiguing, tear, joint pain, signs of kidney problems such as changing the amount of urine.